I now request Dr. Neil Bressler to give us his endowment lecture on revolution in age-related macular degeneration and diabetic retinopathy management, reducing blindness around the world. Welcome, Dr. Neil Bressler.
Thank you all so much. It really is an absolute honor to be part of this endowment award. First of all, you have a wonderful country, and any opportunity to come here, people should jump on it right away. Second, we've known Dr. Natarajan for more than a decade, working in retina with our colleagues around the world. But it's always special when you can come see them in their environment and in the country that they are trying to stamp out blindness and vision problems, because these are universal problems, and it's special to see what they're doing. And finally, if you don't know by now, family is the most important thing to us in the world, beyond our careers, beyond our jobs. It's great when you enjoy your job, and we love our job, as I know you do and many of our colleagues in the room, but family is even more important. And to combine that with a lecture in honor of your father, in memory of your mother, there's nothing more special. So I am very honored to do that, and I'm going to try to do some justice to what we're doing in trying to work on blindness, not only in the United States, as you will see, but throughout the world. I'm going to discuss with you our attempt to eliminate blindness from one of the most common causes of blindness in the world, including India, and this is blindness from diabetes. And I say that we're so close, but we're still far away, and I think you'll understand that as I walk you through what we've learned about this. I want to point out that our university receives grants from several corporations that are working on blindness, but these are grants controlled by the university. And I want to point out one other disclosure, and that is that I do serve as editor-in-chief, as was mentioned, to JAMA Ophthalmology. But one of the agreements I did in taking this on was that journal, which is a pretty good peer-reviewed journal in the world in ophthalmology, needed to be available to everyone for free. It's of no value to publish important works that teach our colleagues how to stamp out blindness if you can only read about it in the United States. And yet it's hard to get journals sent across the world in print. So in this age of digital media, the agreement was, I'll work very hard on the journal, and the AMA has to make this for free around the world, and it is. So you can go to jnreader.com. That stands for Journal Network, JAMAnetworkreader.com, and you can read everything as soon as it's online and available to anyone who has a subscription. Now, it only stays there until it comes out in the print edition, but it's usually online for several months. Then it comes out in the print edition. And then if it comes offline, it's available again within a year that it was first online. So when new information comes out, it is available to everybody in the world. And I think that's how it should be. Now, the problem with diabetes is summarized on this slide. There are, right now, 347 million people around the world who have diabetes. It's a very common condition. The prevalence is highest among those who are between 40 and 59 years old. That is the heart of someone's lifetime when their children are growing up, when they are trying to assume leadership positions in their work, or when they're just trying to support the family. And about half of the people who have diabetes in the world do not know that they have it. So one of our challenges is to get out to the world, and we have to identify who has diabetes before it causes substantial damage to their bodies. Because if we just think about the eye alone, 15 years after the diagnosis of diabetes, about 2% of these 350 million people, if you do the math, that's 7 million people, become blind. And 10%, that's about 35 million people, develop severe vision impairment. So this is the magnitude of the problem. This is a major public health problem around the world. Now, we anticipate it's going to go up about 4% by the time we get to 2030 because there are likely going to be some good things happening. Awareness, we're talking about it right now. We have a lot of scientists working on this around the world. But that will only solve part of the problem, because if you look at certain parts of the world, and India is included among them, they are going to see the greatest increase in the percentage of people who have diabetes and then who are at risk of losing vision from diabetes around the world. And it's going to increase in the number of people who are over the age of 65. And as people live longer, this is a bigger and bigger problem to deal with. Now, there are many factors that are dealing with this. Obesity is just one of them. There are other risk factors as well. And it's likely that this 4% increase is an underestimate of what's going to happen. And I'll show you why. Often the United States has had a lot of innovation in being first with many things. Here's one thing we were first with that we are not proud of, and we show you as a warning so we can work on it elsewhere in the world. In 1994, you can see in the upper left that the orange states here are where about 15% of the population over the age of 40 are obese. Just 15%. But in just 10 years, in 2000, about one-third of the states, 25%, are obese. And if you look on the bottom row, that shows you the percentage of people that have diabetes because it's tightly connected to the obesity problem. So that in 1994, about one-third of the states, 5% of the people had diabetes. In just 6 years, we had about one-third of the states where 7.5% to 10% had diabetes, and the rest of the country, it was 5 to 7% in just 6 years. That's not a change in genetics. That's not a change in diagnosis. That was due, unfortunately, to failing to recognize that diet, while it's convenient and tastes good, when it's fast food, when it's high in fats, can be dangerous to the extreme. Not once a month, not in moderation, but in the extreme. And if we don't educate people, then we'll have the same problem that happened in the United States, because, as you can see, how sensitive this is. Let's go back. Okay, let's try that again. Can you push the button forward once? Good, and push it again, please. Great. As you can see, in just 10 years later, what happened was almost the entire nation in the United States, over 25% are obese. See if we can touch this lightly. And what happens is about one-third of the states, 10% of the people or more, have diabetes. So this is not happening for any reason other than we failed to recognize the education. I'll tell you, the good news is, if you look at the Center for Disease Control in the United States, where these data come from, you can see that it's finally leveling off around where it was here at 2010 or 2011. And it's because it took us about 10 years to recognize and about 10 years to get programs out. But it's a warning that this is part of the problem, and we have to get out to the entire population and make sure this is understood so that 350 million doesn't become 450 million. or a billion people. Now, one reason that we're so concerned about diabetes is if you survey people who have diabetes, 2 of the top 10 things that they are concerned about are going blind or having other eye problems. And that's because, as has been mentioned earlier, vision is so fundamental to our quality of life. While we are certainly concerned that diabetes can affect the kidney, it can affect the heart, it can affect many other parts of the body, the part that has the greatest impact on diminishing someone's quality of life happens to be the impact on the eyes. We're going to try and go backwards here again. Good. Let's try and go forward just 1. I'll try that again. Can you go forward just 1? All right, I'll touch it. Don't touch it. All right. This shows you, if you ask someone where they value the various diseases that are going on the right-hand side, you can see that the utility value, you don't have to worry about how these are obtained, but the utility value of having a moderate stroke is about 0.73. The utility value of having moderate vision loss is about the same, 0.72. The difference is, if you have diabetes and you lose a moderate amount of vision, that quality of life goes to about a utility value of 0.72. That's the same as someone who has a moderate stroke. People that have moderate strokes, unfortunately, often are in their late 70s or 80s. Someone with diabetes with vision impairment is in their 40s when they reach this value, and that's why we need to eliminate the vision loss from this. It impacts us because we need vision to read, or we need vision to recognize people, and even if you are illiterate, when you lose your vision, you fail to want to interact with everyone around you because you cannot see who's in the room, who you're talking with, or what the interaction is that's going on. So that people who lose vision can just develop dependence on others. They do not like being dependent on others, and they get depressed about being dependent on others. Now, the problem with having diabetes is that over time, about 40%, as we said, will have some damage to their eyes, and that includes about 20% that will have some vision-threatening effect of their diabetes on their eyes. Now, I'd like to explain how we are trying to attack diabetes. And while we have started this attack in some programs in the United States, we are looking to expand this and show the model to the world. So if you think of the eye like a camera, it works like a camera. Light goes right through the cornea. It gets focused by the cornea and then by a lens in the middle cavity of our eye. And then it gets focused on the back wall of the eye. And the lining of the back wall of the eye, for about a millimeter thick, is the retina tissue. This is the light-sensitive tissue that makes a picture of what we see as the light comes into our eye, and it goes down the optic nerve to our brain. Now, if you look in the back part of the eye, the very central 3 millimeters is called the macula. And here's a photograph of it looking straight on. It's a tiny area, but it's specially designed to be able to see fine vision. And unfortunately, it is the macula where a lot of the damage occurs from diabetes. So as you're reading the letters on the top of this slide that says macula, center of the retina, you are using your macula to read that. If you stare at the door, you can still see the slide while you're staring at the door, but you cannot read those letters because the side part of your retina cannot see fine enough to make out letters. And so if you damage the macula, you cannot use the rest of your retina to see. You lose the ability